Hey guys, what's up? Just so good to see you guys again, and we're so super excited to have Angela Simpson with us here today. And we're going to be going through her journey into functional medicine and the fast track program, and just super excited to hear where she's at the moment and go from there. So it's going to give you some great insights to exactly, how you can fast track into functional medicine. And we want to hear Angela's story. I think she's just super, super good at what she does. She's just been so coachable and teachable and just has a huge passion for her patients. So welcome, Angela.
Hi, Garric. Thanks for having me on.
Yeah, so great to have you on. And maybe just start by letting us know exactly, what your practice is, how many years you've been in physiotherapy, just some basic background. It'd be fantastic to hear more about that.
Yeah, sure. So I've been a physio for 13, almost 14 years now, and I do run my own practice, and I've been doing my own practice for about 6-7 years. Lots of one-on-one work with patients, all different types, sports physio, regular physio. I also do a bit of pelvic floor physio. So all types, and it's been very interesting to transition some of these clients into the world of functional medicine.
Fantastic. So you're in Canada and you're warming up at the moment. And you're seeing patients we typically see all over the world. It's no real difference. And so tell us a little bit about going through those niches that you've really become good at before functional medicine, and just where were you at with that? What kind of outcomes were you getting, and how did you feel at that point?
Right. So I would say with the general population of physio that I was treating, I felt like, for example, someone who was post-surgical or needed just to mobilize their knee or their shoulder, those people weren't too hard to get better. You just get them moving again and off they go. But there was definitely a fair percentage of people, the longer I practiced, the more I would see more complex cases. And I found I would treat them, and some people would respond well, but a lot of people just wouldn't get better. They'd plateau, or they'd go up and down, they'd get worse, and it was really tough to figure out how to help them. I felt like, there's got to be something else that can help them, but I don't know if I have the skills at this point to move them forward.
Yeah, and that seems to just happen with so many of us. I know that's where I was at that stage. And how did that make you feel when you got to that point where you just didn't have anything else in your skill set to kind of just move them to the next step?
Yeah, it didn't feel that great because I knew they still needed care and help. And so I would definitely still work with them. But I felt in some ways I was doing, some Band-Aid type physio versus actually fixing the problem and getting to the root cause of why they were not getting better.
Yeah, absolutely. And what type of patients were you typically seeing that just were kind of getting to that plateau or that stuck position? Was a certain group?
Yeah, I would say either at work, or I'd seen people that had had concussions. Maybe they had had more than one. And so they just weren't getting better as quickly as I would like because they had had multiple injuries. I definitely have seen people that have also kind of that fibromyalgia type diagnosis or presentation, and there's multiple areas that are bothering them. And so it was challenging to work with them and figure out how to address the root cause and get them better. So all different types.
Yeah, it's never just one area. It's many types, and we see so many different diagnoses nowadays, and really it's coming down to multiple, as you know now, multiple different underlying root causes. And at that stage, were you looking at other alternative medicines to help those patients? Were you kind of thinking out the box? Yeah, I know you had explored some avenues.
I was trying to think outside the box. I feel like I've done so many different physio courses. I did visceral physio I practiced that for quite a while, and I felt like that was helpful to patients. It gave them a different avenue, but I also was doing some alternative type medicine for myself for my own health issues, and I was working a little bit with a functional medicine doctor, and so it made me think, I wonder if this could help other people that I treat get better as well.
And then when was the first time you heard about functional medicine? Was it through the practitioner that you were working with, or where?
Yeah, I had a word of mouth from someone I knew that had gone and seen this functional medicine doctor, and they explained to me, why they went, and they said I should try it. And so that was basically the first I'd ever heard of functional medicine. I've worked with naturopaths and different alternative medicines for myself in the past and sent clients to naturopaths, but no, not functional medicine. I've only really discovered even what the word was probably 2 years ago.
Yeah, we hear that all the time. It's such a new medicine, and people often just saying, what is functional medicine? So for you, how did you kind of connect the dots that, okay, this was maybe something that I needed to add to my skill set to help those patients to move forward rather than plateauing and getting stuck and just not moving from their symptoms?
Yeah, well, how I started to connect the dots, I think, was the link with doing the visceral training, because people would, I'd ask them different questions than I would as a regular physio history taking. So I would start asking them about their digestion, or I'd ask them about, different things going on in their systemic system versus just like a musculoskeletal type assessment. And you'd start getting these different answers coming up. Oh, I've got heartburn, and oh, I've got this. And so, you'd start connecting the dots that there was other things going on inside their bodies besides just their elbow injury or their sore neck or, their knee that keeps swelling up and doesn't get better. I was thinking, there's got to be something else going on. I have osteoarthritis in my knee after multiple injuries, and it would flare up at times too, and it would seem like it was out of the blue. And I'm thinking, well, why, is this happening? I haven't done anything different with my exercise. So there's got to be something else going on inside the body.
Yeah, amazing. Hey, start to just intuitively start to connect those dots. And then when you were working with the functional medicine practitioner there, did you get results that you thought, okay, now this is something worth pursuing personally because you had results, or how did that kind of move you forward?
It helped me. The doctor that I saw was very helpful with diagnosing and teaching me about health genetics and pointing me in the right direction for the types of testing I needed to do, so I could figure out what was actually really going on with me. Did they help me get 100% better? No, but they did lead me down the path so I could help figure it out more for myself. But I knew there was definitely still a gray area where I needed to learn more.
Okay, got it. So that was also part of just connecting the dots, that this is something you need to explore more and dig deeper into it.
Yeah.
So where did it go to from there? How did you kind of connect into the program and get exposed to it from there?
Well, you know how Facebook is. So I was looking up different things on functional medicine after working with this doctor, and then your link to this program popped up on Facebook. And so I clicked on it, and I, just read some of the details of it, and I thought, this is exactly what I need to progress my practice. This is what's missing.
Yeah, I remember when you were probably one of the first people into the Facebook group that we're broadcasting into at the moment. And I still remember one of your posts coming through and saying, is there some training for physiotherapists in functional medicine? So you were actually instrumental in starting a lot of that process along the way. I don't know if you remember that post.
I do. I remember thinking, how can I get into learning this and actually providing it for my clients versus having to send them to these people? And in my area, there was just one doctor, and she was here only half the time. So there wasn't really much I could offer to people.
So for you, was it like that's an instant decision, let me just get going? Or did you have to kind of think through it and decide, okay, is this really something that I need to pursue?
Because of the background I already had with my own health and seeking this out, and just my personal beliefs in the body that can heal itself if you know what to do, I just knew it was the right thing to do right away. It was just instantaneous. I knew I needed to do it. No questions.
Yeah, and I know you were one of the first people to go through the functional medicine fast track program. And I mean, it is a unique program. There aren't many programs like this. And I know when I went through my training in functional medicine, it took us many years just to get our heads around what functional medicine was, let alone just integrate it into our clinical practice. And then how do we make it, work from a business perspective? So it's interesting now just to hear your perspective of where you've come along and gone into the functional medicine fast track program. How did you find that? How was that experience for you?
It was life-changing for me in multiple ways, personally and then also professionally. So it really changed how I looked at people when they came into my practice, just my regular physio practice. I started asking them different questions. Some of the questionnaires that were available through the program, I'd start just giving them the questionnaires and looking at them and figuring out from there what they needed. And so it really changed how I looked at being a physio. It made me have multiple avenues for helping people and realizing too how open people are to that type of help if you present it to them in an organized, logical fashion.
Got it. So you had a pretty busy practice and you still got a busy practice. Was it easier enough for you to integrate, relatively early?
It was. It definitely came together more once I finished the program. I was slowly integrating throughout it, but now that I've been finished it for a little while, I mean, not that long, but I have several clients from my physio practice as functional medicine patients, probably 20%, I would say. So
Wow.
they're all very receptive and open. And, I have a couple of key people that are getting better. And it's really exciting because they had a hard time getting better from a lot of different things they have done already to try and heal.
So, I mean, that's amazing. So 20% of your practice is literally going towards functional medicine now. And you've got a full practice, I know.
Yes.
So that is amazing. So within a few months, you've just really transformed your practice from where it was to where it is in that short space of time. How is that feeling now that you know what you can do to offer those patients, an alternative and kind of move them to that next step? Where is that feeling, or what has changed from before to after?
I think it's changed my confidence level, definitely, in regards to how I can help people now. I have a whole different outlook on health in general for myself, my family, and it also gives me a lot of hope for clients that think they maybe can't ever get better, that there is a way to help them now, and it's very structured, very organized, it's objective, there's lab testing, there's results that patients can see, and they can understand their health. A big part of it is for them is to understand what's going on in their own bodies. And then for me, it has just made my physio practice more fulfilling on a whole.
And when you say more fulfilling, what do you kind of mean from that?
I think at the end of my workday, I feel like I've helped people a little bit more potentially than I was before as a whole person. And so I definitely gain different energies from working with people, as I'm sure everyone does as a physio. You have those days where you have that energy where it just people are, it's not going that well. And then you have days where people are feeling better and it goes really well. And so I feed off clients' energy a lot of the time, and it helps my energy and my health. And energetically, I feel a lot better, since I've been helping people in this way.
So you're feeling more consistency because you're not having that 20% or 30% that are just getting stuck, not plateauing. You know that you've got options to be the detective, move forward, understand the deep underlying root causes, and you can pursue it. So that conversation has changed with your patients?
100%. And those people that have, that you see and you see again and you see again and they've plateaued, they're starting to move forward again in their life. And it's so great because it's all aspects of their life. It's not just the physio part of it, like they're sore or whatever it is. Because it looks at their whole life, the whole picture, obviously. People that are going to be doing this course will learn that very quickly.
Absolutely. And just any like specific examples of patients that were stuck in the past and you've now plugged in the functional medicine side and they've had some changes? Anything that you can kind of help viewers to understand the changes that you've seen personally with patients?
Yeah, I've had this one patient, two patients, but one in particular that I found it quite interesting. She's been not feeling that well for the last 4 or 5 years. She's had all these little tendon and joint injuries and just digestive issues. She just hasn't felt well. It's affected her mood, affected her relationships with her husband and her kids, and just in general not feeling that well. Seeking out lots of help, seeking out lots of care, but never really getting better and feeling quite frustrated. And couldn't figure out why. And what was the trigger 4 or 5 years ago why she, just didn't feel good anymore and started getting injured all the time. And so we ran her genetics test, and then we ran one other test. We ran a fatty acid profile, and we looked at what's going on inside her body genetically and then real time with a blood spot test. And then we talked about her history, and it came up that she works in a really, really smoky environment making coffee beans for a living, and she started doing that 4 or 5 years ago. And so we looked at her genetics, and it really linked up with what was going on inside of her body. And so she's taken a break from that. She's stopped doing that short term. She doesn't know if she can do it long term financially, but she's taken a break from it. She's changed around her diet and her exercise a little bit, just to be more specific based on these tests. And she's feeling so much better. So, and it happened fast too. Like it happened within a month and a half.
Oh, wow. After she's been struggling for a number of years.
Yeah. 4 or 5 years of feeling, in her words, feeling just terrible. So,
wow. So you turned that around, and she's been to multiple other doctors about that, or?
Yeah, they were, she'd been to all these different doctors trying to figure out, does she have an autoimmune condition? Is she borderline autoimmune? Does she have chronic fatigue? Does she have, fibromyalgia? Like, what has she got? And, trying to get diagnoses and all that kind of thing, and never really coming to any conclusions. Seeing all different kinds of holistic practitioners. Yeah, so that was really interesting, just to kind of, I think for her, the understanding of what was going on inside her body made a huge difference to her mental health. And
right.
A way to move forward with a really organized plan.
Wow. Okay. So you did a number of things there. You were able to first connect the dots of the environment she was in. You understood her genetics, and you understood the pathways there and what was happening on the fatty acid profile. And that empowered her to understand from a timeline perspective how she had progressed.
Exactly.
And that was creating the imbalances at cellular level. So that is phenomenal. Is that something that you could have done before understanding functional medicine?
I don't think so, because I've seen her on and off over the last 4 years for various things that have come up, and she's always frustrated. She's never getting better. So no, I was treating her more, I would say, symptomatically.
Yeah, amazing. Yeah. So now I know one area that you just tend to really gravitate towards and love is the genetics. Do you want to tell us a little bit about that, how you've integrated that into your practice, and how often are you using it with your patients?
Yeah, I'm using it a lot, actually. I've ran it on my whole family, my extended family, my parents, my sister, and then quite a few of my clients as well. So basically anyone who says that they are game to move forward and do some functional medicine work with me, I'd say maybe there's like one or two people that I haven't done a genetics test on. All of the rest of them I've done genetics. Because I feel that it's the base for people to understand the potential underlying processes that can be going on in their body if they're not taking care of their environment and their diet and their health. It teaches them, what they need to do. And so I think it's just fundamental. If they don't understand that, it's hard to say, oh, you need to do this diet. But when you say you need to do this diet because, and then you show them, for example, that they have inflammation genetics, or you show them that they have methylation genetics that aren't not necessarily going to be working that well for them if they don't do this certain diet or if they don't do this amount of exercise. So it makes it more clear. And it makes them buy in and understand that they need to take care of their health in specific ways for them.
Fundamental. So, I mean, you've seen that as not just gathering great information, but you seeing it as a tool to help them understand why they have to implement certain nutritional strategies, supplement, exercise, whatever it is, because there's that link back to their genetics. So the usefulness of it is not just purely in seeing the genetics and what we got to do, but it's for them to actually see in their mind, okay, there is a definite reason why I have to do this.
Exactly. It's mostly putting the onus on them and showing them why, and educating them why, so that the ball's kind of in their court, once they understand what's going on. I mean, obviously I'm helping guide them along the way, but, that's the base, to understand genetically what's going on inside your body, or the potential of what could be going on inside your body. I usually run another test with it so we can see what's going on right now inside their body. Yeah. But it gives the base.
Yeah, absolutely. I think that's fundamental to understand genetics. We only have to ever run once, and it guides us into so many different real-time tests that we can do to verify the genetics and what they are predicting. And I think once we understand that, it becomes such a useful tool that, like you saying, you use that with virtually your base start for all patients, because it helps you so much. And I mean, the research is becoming so good as far as just the inflammation, oxidative stress, the diet, exercise, on what to do. It's almost like a no-brainer that we just have to have that done and that data before we can move forward with most lifestyle prescriptions for our patients.
Yeah. Yeah, because I've run a couple of real-time tests without doing the genetics, and then, working backwards, it's a little bit harder. For example, you see something that it doesn't look like they're methylating well, for example. Why? And then if you look at their genetics, you can understand why.
Yeah, it's much easier to predict, because sometimes a lot of the real-time results do skew, and we don't have all the results real-time to give us an idea of exactly what is happening.
Yeah.
So it's interesting as you start to understand it more, how complex it really is. Mm-hmm. And, we can kind of get false positives and that type of thing. So that's become a mainstay in your practice now, just to be doing genetic testing and other real-time tests. Have you got any other examples you want to share just on patients that have transformed, that you've maybe been stuck with for a few years? Or
Yeah, I have one other patient who has post-concussion syndrome, who basically just had a concussion and never got better. And, it's been over 2 years now. And why haven't I gotten better? And she's definitely had lots of different treatments. She's definitely seeked out a lot of counseling and different types of more traditional concussion type treatments from multiple different practitioners, but still not feeling well, not getting better. So ran a Dutch test on her, and her cortisol levels were all extremely low, which definitely can happen post-concussion, especially after a certain period of time. And she had a lot of stress as well, because she couldn't return back to her job, and she was one of the primary providers for her family financially. So there was a ton of stress around her not being able to return back to work as well. So once we saw that the cortisol levels were really, really out of balance, I ran a genetics test on her as well to look and see how else we could help support her. And then we actually also ran a fatty acids test, and her ratios were significantly out of balance. And so once we put the steps in place, a lot of it was centered around diet, but a ton of it was centered around lifestyle and just how much she was doing relative to what her body could actually keep up with. She started to get better. And she just posted on the Facebook a page that I have. It was really awesome. Feeling better than I felt in over a year and a half. Again, after a month of just putting these strategies in place. Like, it was quick.
Wow.
So not long. Like I was surprised, but she's been really, sticking to the plan, and it's helping her.
Wow. Yeah, that's quite something. I mean, we see that when you get that pivot point and you understand exactly where to make the change, because, there's 100 things on a list that can be good for anyone. But when you have the skill like you've developed now and you can really hone into the individual and know exactly where to make that change and empower them, that's when you see the changes within a 30-day period. And just to think, like, if they didn't come to your practice, they didn't know you, what is their life going to be like in the next 2, 3, 5, 10 years if they don't have those changes? And often the changes, as you know, are not necessarily, it's not brain surgery or something dramatic. It's just knowing what to do, what to eat, what to supplement with, how to exercise, whatever it may be. To change those cortisol levels.
Mm-hmm. It's just specific to the person. And I think for them, again, once they saw how low their cortisol was on a test, on a graph, and I said, yes, you need to slow down 100% from what you're doing right now to rebuild your cortisol levels. That actually, resonated. It hit home.
Yeah, and sometimes that's what people want to hear as well. It's like, no, you just need to rest and recover and restore. And when you're giving them the right information and they start to feel it in 30 days, how empowering is that? So that must have made you feel pretty awesome, just getting that feedback in your Facebook group.
Yeah, it was great. Yeah, I already knew she was starting to feel better, but it was great how she posted that. And I saw her actually even just post today on her own Facebook, just on my general group, how much better she's feeling. She posted some link to continuing to feel better. And so, yeah, it was great.
Well, Angela, I'm super proud of you. I think you've just been amazing as far as just sucking up information. You've integrated it into your practice. You've taken on a ton of patients and you're making a difference. And the joy of it all is that you've done it in such a short space of time. So often we see people getting into functional medicine just taking years and still not getting their heads around it. And you've really taken to the functional medicine fast track program, you've implemented it, you're getting the results. And I mean, that is the real way to transform your community, your patients, make a difference. And I'm pretty sure that the word in your community is going to just get stronger and stronger. And you becoming the authority of fixing those difficult patients that just aren't getting resolved from anybody else. I think that's what's happening at the moment in Vancouver.
Yeah, it's great. It's great to help patients because I love, doing that. That's part of my passion. But it's also been so helpful for me and my family's health. And that's like my other big passion, of course, because I have kids. And so like it's a way of life. Like it changes your whole way of going about living. So it's great.
Yeah, absolutely. And I can relate to that as well. And I mean, that's something worth actually mentioning, just having that ability to be self-empowered, to look after your family rather than relying on whoever to make those decisions for your family's health. Because you were saying that you've run your genetics and I assume other tests as well on your family. So you start to really understand them and then you have the ability to implement strategies in your household. Mm-hmm. Do you want to just elaborate a little bit on that for a minute or two?
Yeah, I mean, in a small generalized form, I would say I have 2 children. They're fairly young, but they both have been diagnosed with a couple of issues and relating to the urinary tract and the kidney. And I have had to use conventional medicine, of course, and they have been very helpful in lots of regards. But again, not so helpful in figuring out why this has all happened in the first place and getting kind of to the root cause so that I can figure out how to keep them healthy for life. So when I ran their genetics, both of their genetics, to me, it became quite clear what was going on, why it was happening. and how I can put strategies in place. A lot of it had to do with diet, actually. How I can put diet strategies in place for them to have a healthy life throughout, not just having to go from doctor to doctor and talking about what could be wrong and things they need to manage, but having a real underlying lifelong plan to help them stay well.
No, that is amazing. I mean, very, very empowering. So, yeah, and I know you've done a ton of research there, and sometimes that is where it all starts in becoming a specialist in a certain area and just understanding those deep root causes when it comes from a family situation, because you've got so much invested. Mm-hmm. So, yeah, maybe you can share more about that with us in our group as time goes on, and just let us know the deep underlying root causes in those situations. It'd be fascinating.
Yeah, I don't mind sharing it all as it moves along and plays out.
Fantastic, Angela. Fantastic. Well, it's been great having you on, and just, again, been super proud to watch you transform and just take that functional medicine on and serve your patients at the highest level. And that's all that we want to do in the health profession, is just do our utmost to help our patients. There's nothing worse than seeing our patients just plateauing, not getting better, and we not having any other solutions to help them. So well done to you, and thank you again so much. It's been really, really great chatting to you.
Thanks, Garric. It was nice to talk to you.
Thank you, Angela. Take care.
Take care.
Bye.